Hookworms get their name from the hook-like mouth parts these parasites use to attach to the intestinal wall of pets. They are only about 1/8 of an inch long and so thin that you have to look very closely to see them. Despite their small size, these parasites suck large amounts of blood from the tiny blood vessels in the intestinal wall. A large number of hookworms can cause anemia. This problem is most common in young pets, but it occasionally occurs in adults as well. Adult hookworms in a pet pass hundreds of microscopic eggs in the animal's stool. The eggs are invisible to the naked eye. Larvae, or immature worms, hatch from the eggs and remain in the soil for weeks or months. If your pet swallows any of these larvae, hookworm infection will be established. The larvae may also burrow through the pet's skin and migrate to the intestine, where they will mature and complete their life cycle. Hookworm larvae also pass to puppies from the mother's placenta and through nursing. The most significant medical problems caused by hookworms are related to intestinal distress and anemia from the parasites sucking blood from intestinal capillaries. The presence of pale gums, diarrhea, or weakness would indicate the need to check the pet's red blood cell count for anemia. A blood transfusion may be needed if there is severe anemia. In some pets, the main sign can be significant weight loss. Hookworms are diagnosed through a microscopic examination of a stool sample. Since eggs are produced by the worms on a daily basis, hookworm infection is usually fairly easy to diagnose. There are several effective medications that will kill hookworms. However, the drugs primarily kill the adult hookworms, so it is necessary to treat the pet again in 2 to 4 weeks to kill new adult worms that were larvae during the first treatment. Your veterinarian will schedule any necessary follow-up treatments. Since your pet's environment can be laden with hookworm eggs and larvae, it may be necessary to treat with a chemical to kill them. Ask us for information on when this is necessary and about safe chemicals to use. All stools should be disposed of promptly, especially in yards, play areas, and public parks. Strict hygiene is important to prevent reinfection. Do not allow children to play in a potentially contaminated environment. With direct contact to moist earth, hookworms can burrow into the skin, causing intense itching. This disease is commonly called ground itch. Fortunately, they do not mature to adult worms in humans, so they do not cause anemia or diarrhea in humans, only itching of the skin. Please ask one of our clinic staff if you have any questions.